Are you a
10, 9, 8,
Okay, so we're gonna call the ad.
Welcome to Gather Geeks, a podcast by BizBash, the place where people passionate about meetings and events come together. This episode is a Gather Geeks special sponsor edition. Here's your host, BizBash chairman and founder, David Adler.
Welcome to this special edition of Gather Geeks. Today, we are going to hear how Korea has opened large and small events safely during this past summer. They have become an example not only for combating the pandemic, but for safely bringing events back online. With my guest co-host, Stephanie Cheung, we will hear from Juri CEO, who is an executive from the Korea Tourism Organization, and Dr. Richard Arriviello, an emergency medical doctor from In-House Physicians, a group that actually becomes the on-site medical partners for event organizers. With event safety being the number one concern, our discussion offers tips and suggestions from Korea, who learned from the SARS crisis and applied its early learning to be one of the first countries to effectively curb the pandemic. This is a conversation that could give you the key learnings to help the opening of our event industry. So let's listen. Welcome. And Steph, my co-host on this episode, what are we trying to accomplish today?
First of all, David, thanks so much for having us. Honored to be a partner with you on this. I know you've been a longtime veteran of the industry, and at such a critical time of reinvigorating the industry, for lack of a better word, for me, it's a great pleasure to be able to introduce my client, Juri, who's manager of corporate and incentives with Korea Tourism Organization, because Korea has actually been on the leading forefront of not only curbing the pandemic at a really early stage, but also some really innovative infrastructure that allows for the future of meetings congregating again in Korea.
Yeah, I think we can learn a lot from this discussion. When I first heard that we were going to do it, was how can we take these key learnings and have Dr. Rich actually help us interpret the things that we can do here, as well as give us the read and take away some of the jargon in a sense and make it simple for us to understand.
I think you hit the nail on the head there, right? Because not only do we need to think about where can we travel to next, but we really need to remember at the end of the day, it is a science matter. So, Dr. Rich, I have to echo David's appreciation for you taking time to join us to offer a medical perspective on COVID-19 as a whole and what the future of gatherings will look like. Awesome. Why don't we get kicked off by Juri? And Juri, if you don't mind, can you share with us the situation in Korea now so we can first get a bigger understanding of how did Korea even respond to the pandemic in the first place? I know you were written about in a lot of different articles actually from the beginning, really praising Korea's government's rapid response to the pandemic and what that looked like from an infrastructure perspective, from a just policy perspective. We would love to hear from you first.
All right, so I'm just gonna start with the beginning. And to begin with, Korea had the first outbreak in January. The confirmed cases were up at the peak, up to 900 confirmed cases in a day in February. However, the government implemented effective strategies to mitigate the pandemic, and it was also more notable to the world because we've done it without closing the border or immersive lockdowns of the businesses. So those strategy to begin with was they did extensive testing within a short period of time. Korea maximized its testing capacity up to about 20,000 tests per day by developing test kits in a short period of time. Testing obviously is very crucial to quickly identify patients and isolate them. On top of it, the government fully provided tests and medical treatment costs regardless of the nationalities. And this had encouraged people to get tested without concern for the cost or getting the treatment afterwards. Korea is also the country which has first utilized drive-through test centers to minimize the exposure of people. and the first respondents to the virus. Another key strategy was to implement contact tracing. By applying contact tracing, it was able to track down the infected individuals and those ones who had been in contact with infected people. The information is then released to the public to notify the movement of infected individuals. So people had been in close contact with infected individuals will receive text messages, and if necessary, those who received text messages will need to get tested. So after implementing those robust strategies, the number decreased significantly. So the government eased on distancing in daily life in early May. So under these eased distancing in daily life measures, it allowed MICE industry, meaning that they allowed gatherings and events with any sizes under safety protocols, as well as public facilities to resume operation in phases, beginning with national parks, galleries, and museums. So that happened in early May. But however, we saw the upward curve in the middle of August. So the government has restricted the policy again to minimize the gatherings. And that's the current situation in Korea now.
Do you want to comment on, Dr. Rich, on how the testing methods were different and why Korea was so successful at damping down the virus and that we haven't been from the point of view of the bigger picture, and some of the things that we've learned from them that we should or maybe didn't do, but we should have done?
Sure. I think we got a little bit of a late start in general as far as considering this a real national, international threat. So we were, I think, behind from the very onset. And I don't think we had the infrastructure in place for testing early on. What we did notice on a local level in emergency departments and urgent cares that we ran out of supplies quickly as far as viral transport mediums, and how we got testing done. It was mostly PCR testing, which was a lab-based testing early on, and that took weeks sometimes to get results. So the average was 7 to 10 days, sometimes as long as 2 weeks or greater. So it was very difficult to actually do contact tracing because you weren't getting the results in a timely fashion. And then whoever was responsible for doing the test had to contact that local Department of Health, and then the Department of Health would do contact tracing. But you had to make sure you had all the demographic information correct for them to contact that person and do the tracing. So it was a very slow, arduous process in the beginning. And now with the advent of multiple point of care testing with the Abbott ID Now machines, etc., we're able to do testing and get results in 15 minutes. Not as accurate, not as sensitive and specific as a PCR test, but very close. And it will help us take that infected person out of the population quicker so they can infect less people. So I think that was the big takeaway point. We needed to do more testing earlier. We just didn't have the supplies to do.
So let's jump a little bit into our business, our industry. You talked about how events were coming back, Juri, and that you've had some very interesting specific case studies of how you actually did it. Do you want to go into that first, and then we can use that as a framework for the rest of the discussion?
All right. So when the government eased on social distancing in early May, as I mentioned earlier, events and meetings have resumed in May. However, we faced the upward curve again in the middle of August. So currently there is a ban on indoor gatherings of 50 or more people and outdoor gatherings of 100 or more people. This will be effective until the end of September, and the new guideline is expected to be announced soon. So going back to before imposing a ban on 50 or more people gatherings in the middle of August, Meetings and exhibitions were hosted actively between May and August. Between that time, over 1 million people attended over 100 exhibitions and expos that were held in Korea. No infections were reported after those over 100 exhibitions. So, for example, in May, Kintex, which is the biggest convention center in Korea, was the first convention center to reopen its exhibition halls for the first time since the outbreak in January. It was NBC Construction Expo and it was hosted for 4 days in May. And this trade show attracted more than 45,000 visitors attending the expo. Of course, strict safety measures took place while hosting the event, like thermal imaging cameras and facial recognition thermometers were installed at the entrance, along with hand sanitizer dispensers and disinfection mats and plastic gloves. At the hall entrance, attendees' temperatures were monitored by a non-contact thermometer. When further investigation into attendees' health status was needed, individuals were immediately transferred to a containment area, and also emergency room and medical staff were on standby for the whole time. The entry line was installed at 5 feet intervals on the floor. In, in disinfection was conducted twice a day with 100% external air intake and air conditioning. All visitors were required to wear masks and plastic gloves, and exhibitors were required to wear face shield, which covered their entire face. Also, acrylic barriers were placed on tables of the business meeting area and cafeteria. Booths were at least 13 feet apart, and a video conference facility was also made available for those exhibitors. Lastly, ambulances were on standby to transfer patients under investigation in cooperation with local authorities and nearby hospitals, as well as Kintex, the major convention center in Seoul, COEX, held their first exhibition in the first week of June after the pandemic. Like similar safety measures include installation of thermal cameras and air purifier, disinfecting inside and outside of the exhibition halls, multiple placement of hand sanitizers, extra medical and security staff on site, and attendees like lastly, and they also attendees also had to register with a QR code, which allowed to find anyone with potential exposure to the virus after the event. So COEX also had a large-scale meeting in July, which had about 20,000 people attend the event.
So, Rich, let's just jump in for a minute. Dr. Rich, can we do that here, or are we not set up to do that? I mean, it seems like they have a very defined protocols for safety at events. And what can we learn from what they're doing? And can we get to that point of being safe and doing that?
Adding to David's question, I'm also curious to hear, because Juri just pointed a lot of specific protocols, and perhaps to extend that further, a little bit of innovation on the side of these venue suppliers, right? Whether it be a convention center or a hotel, in order to support safe meetings. So adding on to David's question, can you maybe also speak to some examples of innovation in the medical space that can help support safe gatherings?
And you are actually doing this now. Dr. Rich, you are actually going to events and being the guy on the scene to keep it safe.
Yes, that's correct. So we are starting meetings and events again. It's smaller scale than 20 to 45,000. Most of the events that in-house physicians has done over the years have been from small meetings and events that can host maybe a dozen or so to up to 4 to 5,000 people. Our largest meetings and events are about 20,000 worldwide organization meetings. So we've done multiple meetings, multiple sizes, but right now we're getting back to meetings and events smaller scale. And what we're doing is a lot of what Juri had already said as far as safety measures. Everyone's wearing masks, hand sanitizers, and so forth. But these are smaller events at either a corporate office or a hotel space that they're only using a certain amount of rooms. But we're also doing on site testing. We are actually screening right now all the attendees that come in, and we screen them upon arrival with actual rapid COVID testing. And then we also have screened the entire hotel staff that's taking care of these people that come in. So we've not only screened the attendees, we've screened the hotel staff and tested everyone to make sure they are negative. And we also retest them upon departure to make sure they did not contract the virus at all while they were there before they go home.
Juri, do you have you've obviously been figuring out ways to scale it. I can imagine the lines at these places have got to be enormous. How have you talked about that issue? And then, Rich, what do we do with our scaling the concept of letting people in at a fast pace?
Right. So the Kintex, which had the first big convention in May, like they shared their challenges and lessons they learned from their first exhibition after the pandemic. That were like there was such a long admission line and congestion in the lobby because like usually it took so much time prior to entry to put on plastic gloves, apply hand sanitizers, and take everyone's temperature while maintaining a distance between the visitors. So to resolve this issue, they added more personnel from 3 to 9 to the entrance to reduce the admission time. Also, they used the empty exhibition hall to open and the admission line redirected within in order to eliminate congestion in the lobby area. Another challenge was that long registration lines were also due to the required on-site registration despite all attendees having already pre-registered. This extra step was considered required for them in order to obtain the identities and contact information of each visitor for the purpose of social tracking afterwards. So to resolve this problem, they added 4 more registration booths and recorded the visitor's admission date and time for tracking purposes. So yeah, those were some of the lessons they learned and from the first exhibition.
What we've done, I have one question for Joy. We know that about 40% of patients will be asymptomatic, and that also means without fever. So we know doing temperature screening alone will miss up to 40% of patients that actually have COVID. So I'm curious as to after your event, when you did follow up, there's a possibility that there's 40% of people who could have had virus but did not spread it because they were wearing a face mask and doing personal protective equipment. With follow up, did you have any positives at all after your events?
As far as I know, they had no positive results after all of those events. So that yeah, that's all I know. That all of the events like were hosted successfully without the positive cases.
Wow, that's interesting. So yes, we're doing something similar. We are when we're doing our screening, we do have everyone that are getting tested. They sign off on a consent and a waiver. They do that electronically through an app. So when they get there, we just have their name that we check off. When we screen them, we have stations set up that are partitioned and we just one at a time, but we have multiple providers there that are doing the actual testing, so they can come in, get tested, and then we have waiting areas with chairs that are spaced appropriately apart while they're waiting for their results, which come out in 15 minutes. So that's our kind of registration process. Again, most of these meetings that I'm holding now are maybe senior executive corporate type meetings, and they're on smaller scale right now, but in-house is actually doing surveillance and mass testing on college campuses all over the country right now for students to return to learn safely.
Juri, did I hear you say that all attendees wore gloves as well?
Oh, yes.
Dr. Rich, we don't have that kind of rule right now, and would that be more effective? Does the having gloves help the situation?
I think we're talking about two different things: a convention versus a meeting of senior executives, board of directors, regional directors, and things like that are sitting at a conference table. So the venue is a little different. Most of the meetings that we hold they're going to be training. A lot of this is training or board of director meetings. So what they've done is they've set aside 3 to 4 conference rooms with chairs spread apart, and those 3 to 4 rooms are talking to each other via, so not everyone is in the same room.
Even though they're together in the
Same facility, different rooms, yes. So they're practicing social distancing even in corporate meetings.
What about if we do get to the convention size? Do you think that it's going to be standard operating procedure for people to wear gloves and facial screens as well going forward, or do we ignore the gloves?
Yeah. No, that's a great question. Right now the most important thing, and I'm sure Juri would agree, that is mask wearing. That is the number one safety measure we can implement. A face shield was in place mainly in the beginning to protect any kind of aerosol or droplets from coming at your eyes. So, mainly that was from coughing, sneezing, or actually doing testing. But if we were mask wearing and doing hand sanitizer, I think we could still keep the transmission rate very low with mask wearing and social distancing, as well as ample supply of sanitizers. I think that would be key.
I was just super excited because actually hearing what you're describing gives us and myself, and I think speaking on behalf of everyone listening right now, a lot of confidence as to seeing that there are specific safety measures that as an individual we can take, and that as a destination, a hotel, or a convention center that can take as well. Now, if we look ahead, it sounds we have the precautionary measures, but a big issue I see is comfort level from an individual participant perspective. So I appreciated that Dr. Rich made this distinction between even the types of events, right? If you have a specific corporate event in which high level executives need to meet, then the propensity to travel or the risk taking from the individual perspective, I think, is easier to move forward. And then at the same time, from a conference or agenda perspective, it seems like it will truly be down to comfort level of travel. So as we communicate this to the greater public about the fact that there are measures in place that can allow you to meet safely, Dr. Rich and Juri, what are some of the key takeaways that as a meeting planner, I can share with my stakeholders to ensure them that these safety measures are strong enough for people to meet again?
Yeah, I think basically we've talked about this when we talked last time about buy-in. Everyone has to buy into the notion that the simple things like mask wearing and hand sanitizers do work. And if that was the only thing that we did, that would prevent the vast majority of any transmission. So I think people just need to buy into the notion that strict mask wearing, not mask wearing with it under your nose or improper mask wearing or just wearing it when people are looking. So you got to buy in and say, listen, I understand that this is how this is transmitted. I need to wear my mask, the kind of attitude that it starts with me. And if we can have people buy into the fact that we can do meetings safely, if you would just do the very simple things, wear your mask all the time, wear it appropriately, and use hand sanitizers that are all over the place that we see in hotels and lobbies and everywhere. If you do those simple things, I think we can absolutely have meetings safely. And testing on site is just an adjunct to basically say you're clear to go to the meeting. And we also have an app, a self-question app that we use that answers so many questions. You have to be fever free, but if you have any symptoms, that app will give you a thumbs down, and you need that app to enter the meeting. So if that app gives you a thumbs down, you have to report to the medical or on-site medical clinic to get cleared to go to the meeting.
Yeah, I can say that. And also, like, medical tourism is becoming huge industry in Korea before the pandemic. This industry started from 2009, and it has been rapidly growing over the years. The number has increased annually by about 23%, reaching foreign patients from 190 countries in 2018. Like, the inbound medical tourists increased because Korea has excellent medical infrastructure, because like we have advanced technology and state of the art medical equipment, as well as the reasonable price. Also, like, Korea's insurance system, which is national health insurance, was effective because due to this system, the government provided the full cost of tests and COVID-19 treatment. And this system is compulsory insurance for all of the Korean citizens. So like those infrastructure, like we were able to like give the good medical treatment, as well as the providing the test within the short period of time.
So that medical tourism is making people feel more confident that if you're known for medical tourism, that means that you've got a good infrastructure. People come to America, or at least they used to, because we have such great medical care. And it sounds just being in the event side so that you are traveling to another country to go to a meeting that you're going to be okay.
Yeah, but the like obviously the border has to be like opened, and we have like all borders open in Korea, but there is 14-day quarantine rule that has been imposed from April. So all of the inbound travelers, they have to be quarantined for 14 days. So like Korean citizens, they can do self quarantine at their homes. Foreign people who enters Korea, they have to be quarantined at the Korean designated facility for 14 days.
Hey, Juri, is that with or without testing? Like, for example, say they landed and tested immediately, and then in another time frame, whether that's 4 days or 7 days from the landing, and they retested, and say they were negative twice, will that adjudicate them of the 14-day quarantine, or is it 14 days no matter what?
No matter what, it's like mandatory. So yeah, it has to be at 14-day quarantine. And if they get positive result, they have to be like they must be treated at the hospital. Yeah, quarantine is mandatory, no matter what.
Hey, Dave, I have a comment about having medical support. In-house physicians has been doing this for over 25 years, providing medical support for meetings and events. And we've done it, and we've kept attendees out of the hospital and out of the emergency department while on site, and saved them tens of thousands of dollars per meeting. Because what happens is if someone does get sick or ill or injured, and they have to go off site, they usually go off site with another person. So you're losing two people, probably in an emergency department for many hours. So we've been doing this for so long that we're just adding COVID into what we've already been doing. We can flu test, we can strep test, and we can treat people on site. So we've been doing it for many years through the flu pandemics also. And this is just basically adding on just another layer to what we've already done, and we've done it safely for many years.
Actually, international travel is really slow, and the numbers has decreased like 98%. So let me just talk about domestic travel first. So like Korea Tourism Organization, we selected, and we are still promoting the nation's 100 untouched tourist destinations to help citizens travel leisurely and safely in Korea domestically. So those selected tourist attractions were determined by reviewing the standard requirements, such as tourist attractions that are not well known in the past, where people can practice social distancing, or where people can do outdoor activities surrounded with the nature. Korea's major holiday, Chuseok, is in the next week, and over 300,000 people are expected to visit our island called Jeju Island during this holiday season. So to get to the island, people must take domestic flights for 1 hour, and they are still traveling because we are expecting over 300,000 people. Because they're traveling, because they trust that public facilities are disinfected and sanitized very frequently, and also take safety measures by mandating people and staff to wear masks during the flight hours, and they take temperature of passenger before boarding, disinfecting aircraft, and flights are also equipped with the latest air circulation system with high efficiency particulate air filters that supply clean, sterilized air to the cabin and ventilate every 2 minutes. Hotels also utilize thermal imaging cameras to detect fever at the entrance. They also measure body temperature of the guest upon check-in and sanitize floors and facilities very frequently. And also to prevent spreading the virus, it is mandatory in Korea for people to wear a face mask all the time when they use public transportations like bus, taxi, and subway. So people are quite confident that that Korea is taking a lot of safety measures for people to travel and to the public facilities, and that's why they are still traveling domestically.
So, Dr. Ridge, tell us about air filtration systems, and can we trust them? And is it critical to what's going on?
As far as
The airplane travel, and just in general, do we feel comfortable? I mean, you're the science guy here. Do we have to judge all of the air filtration systems of any place we go to, including planes and trains and restaurants?
well, did we do that with SARS, MERS, or influenza in the past? We didn't. We never asked that question before, and those are respiratory viruses also. So I use myself as an example because I live it every day. So if I'm working in the emergency department or I'm working in the urgent care, we have probably about a 10% positive rate on people tested every day. And myself and my staff wear a mask. We have all our patients wear a mask, and we are less than 6 feet away from them. We're right next to them, listening to their heart and lungs and examining them. So we do this every day. I'm exposed to COVID every single day, and I haven't gotten it. And that just brings me back to the mask wearing. It's so important. We wash our hands before and after we go in to see a patient. We wear gloves. We change the gloves after we do a swab and so forth. But I'm examining COVID positive patients every day with a mask.
Let me push back, though, a little bit. How do you know that the air filtration system is adequate? That could also be a contributor to this that you don't even know about. Planes are supposed to circulate every few moments, but we're lay people in this.
And that's my point. That's my point. I don't have a HEPA filter in my emergency department or urgent care. We're just using masks and gloves and washing our hands. So that's what we're doing, and the personal protective equipment. Some people choose to use an N95 mask if they have someone with symptoms. So if someone has symptoms, they have probably a higher viral load and can spread it more than someone who's asymptomatic. That's a choice that they can make. But again, most of the time, a surgical mask on both the patient and the provider is doing its job to prevent the spread without all these other measures, including HEPA filters.
Juri, let me ask, you said that the average civilian, average person in Korea is now starting to travel, or is it the domestic travel is coming back? I understand international.
Yeah, people are traveling domestically, and they also take domestic flights to get to the other destinations in Korea. So basically, they are traveling.
We had so much conversation around new regulation policy as well as successful examples of a in-person event in Korea. Now, as we look towards the opening and the new meeting guidelines that are going to come out at the end of September, can you share with us what the new normal will look like for meetings and events in Korea?
Yes, actually, hybrid meetings and like virtual meeting is becoming new normal in Korea, and meetings utilizing virtual techniques are the new trend in Korea's meetings industry. Just like the US, use of virtual meeting applications such as Zoom is increasing very highly, and the number of users of major video conference apps increased over 8 times compared to last year. And Korea's renowned ICT also plays a vital role in meetings industry when we have to adapt to the new normal. So as demand for hybrid events are rising, Korea as a leader in ICT is taking an advantage to adopt the latest IT such as hologram, AR, VR, and AI to the events. For example, last year during Korea MICE Awards and conference, AI robot moderated the event for the whole time, and the robot announced the award winners, and the robot gave out the awards. And also, we utilize hologram, which is a technique where we can see the image in 3D. This industry is it's being the new normal in Korea, and we expect the use of ICT in meetings industry will be rapidly rising, and the government will also actively support to increase use of meeting technologies.
So I have one question that I would like to ask in terms of the hybrid event and in general for an American that's going to Korea for a meeting and event. When you do hybrid, the translation has got to be really important to be able to have more of a mass audience. That's for people that are coming that are on location and for around the world. What is the primary language, and is translation an easy thing with Korean meetings and events?
Because the English is our language, primary is English, and yeah, most of the international conferences are hosted in English, so that will not be difficult to attend to the ultra meetings.
And many Koreans do speak English, it sounds like.
Yeah, many of the Koreans that are within the industry, they speak like a little bit of English. And the website, sometimes they also provide in multiple languages, like English, Chinese, and Korean. So if they select their preferred languages, it will be directed in their preferred language.
Let's end with Stephanie. What have you learned today about what's going on in Korea?
I have honestly just been invigorated by some of the practices that are already in place in Korea, knowing that in September of 2020, it's actually possible to host a meeting at the size that Kintex held it at. And secondly, that I think the future of bringing back meetings truly comes down to being able to communicate that safety measures are in fact strong enough. And I think Dr. Rich gave some very specific examples of, even from a scientific perspective, literally wear your mask, right? Like it's a simple thing that I think we've been hearing as individuals, but hearing it from a medical professional that confirms, yes, that is going to lower transmission levels significantly. And then seeing that in Korea, it's already being practiced together with some of the newest cutting edge technologies that will support that. And what about for yourself? Because I know, David, you have a good bird's eye view of the industry, not only from an international perspective, but also with all the hundreds and thousands of suppliers in the US as well. What were some surprising or key takeaways for you?
Well, It seems like the new normal is not terrible, but we can understand it. And that we're not at that point. Remember when we started this, we were like wiping down our deliveries. We were so overly careful about every little aspect. I call it, we started having this thing called FOMO, fear of missing out, and then we had FOGO, fear of going out.
Oh, totally.
And
David, I was carrying, anywhere I went, I was carrying like 75% rubbing alcohol, like in a little spray bottle. And I would literally use that before I touched anything.
So I think that from a medical point of view, we understand this disease more. And the fact is that Korea went through SARS, means that they were inoculated a little bit from the fear as much more than we were. And they were able to innovate, and that whole idea of medical tourism and the culture made it so that they really took the process and attacked it head on, where we had to go through a hysteria period. Rich, do you think there's some logic in that?
It's the fear of the unknown. So we didn't know. We didn't have any frame of reference. And we go back to what we talked about the first time we all met, is the buy-in and the trust. In the U.S., they don't trust the government at all, sometimes rightly, but it wasn't really so much the government as we just didn't have enough data early on. As the numbers increased, we learned more. And I think what Juri said about being transparent is key. Be transparent. And if you're wrong, or if you get it wrong, just admit the fact that you got it wrong, move on. And I think that would give the public so much more confidence in their government if they say, listen, we got it wrong initially. Yes, you should wear your mask, or whatever that mistake was, or oversight or undersight. But I think with all the measures that we've talked about today, and the simple things like wearing your mask properly, social distancing, hand washing, not only, I think in meetings and events are safer than they have ever been, because we never did any of this with influenza. And we had influenza outbreaks at meetings where we would have 30, 40, 50 people come ill and almost have to cancel a meeting. This will, I think, make meetings and events even safer, with the adjunct of on-site testing to test and pull those people who are asymptomatic out of the population from even having a chance to infect anyone else. So I think meetings and events will be safer than ever.
Dr. Rich and Juri, thank you so much for sharing the best practices of hosting events safely in Korea, and for an objective medical perspective on how to continue moving our industry forward.
Thanks for listening to today's episode. If you like what you're hearing, be sure to subscribe to the podcast on iTunes or your favorite podcast app. We can be found on iTunes, Stitcher, SoundCloud, Player FM, Google Play, and Pocket Cast. Be sure to leave us a rating and review. It helps others discover the Gather Geeks podcast. We'd also love to hear from you. You can leave feedback on Twitter @GatherGeeks, or leave us an email, gathergeeks@bizbash.com. We hope you'll join us again for the next episode of Gather Geeks. Until then, gather on.